Okay. Okay. We're very glad that you could join us, and we thank Reverend John for supporting this endeavor. He is our technical person tonight. I'm going to have each of the panel members just introduce themselves with their name and their area of expertise, so you know who our panel members are. So Amy, you want to start?
Sure. Hi, everybody. I know most of you, but for those who don't know me, I'm Amy DeBaets. I'm a member of the congregation, and I am the Director of Bioethics for Hackensack Meridian Health in the North Region. And my relevant expertise for this evening's conversation is that I spend much of my day working with patients and their families on values-oriented decision-making in healthcare. And so that's what I can help support this fantastic panel here tonight.
Super. Angela, you want to go next?
Hi, everybody. For those who don't know me, my name is Angela Boyd, and I am a member of FCC and a first responder and a student.
Student nurse. Yeah. Portia, you want to go next?
So I'm always so excited to hear about student nurses. My name is Portia Chinnery, and I am a registered nurse for a little over 26 years now, with most of my experience being in emergency and trauma services and actually running the ER. And for the past 5 years, I've done patient safety and quality, which leads me to why I'm here, because we want to make sure that we do the best things for not just the patients that are in our hospital, but around in our communities as well. And so you are our community, and so that's why I'm here.
Super. Armee?
Yeah.
Hi, everyone. My name is ArmeeGrace Campos. Everyone at FCC knows me as Armee. I work as a nurse practitioner in internal medicine. I've been a nurse for, 12 years, 3 of them as a nurse practitioner. Thanks.
And you all know I'm Reverend Heather Cherrey. I am Minister of Pastoral Care and Visitation, formerly a nurse, and a nationally certified grief counselor as well. So we have, if you have questions, you can put them on the chat or just address it to me. The session is being recorded and will be posted on FCC's Facebook page so that people can, let other people know about it if they want to take a look at it. So I'm going to start with the questions that we received in our survey. So the first one is updated guidelines. Masking not required for fully vaccinated. Why is it requested at FCC? So who on our panel wants to answer that one?
I'm happy to
I can start.
Or do you want to, why don't you go ahead, Portia? Thank you.
So we were just talking about this, and although guidelines are put forth and the CDC is wonderful and they've been creating all of these great guidelines for us, we still have to do the right thing based on the population that we're going to be around. And of course, when you go to church, there are other people that are joining you to worship. And if you're inside of a building and, even if you're socially distanced, there's much more of a chance if there's someone who is not vaccinated. As we know, 100% of our population is not vaccinated, not even 70%. We have to be able to protect those of us who are not vaccinated. So it's actually, you're actually doing the masking for others, even if you are vaccinated, to make sure that others are not going to become infected.
Thank you. And following that, what are the stats for vaccinated people getting COVID? Do we know of any?
I don't have stats, but I do know that there is such a thing as patients who are vaccinated getting COVID. The wonderful thing about that, though, is that if they are infected, they are not infected to the point of needing hospitalization or any serious treatment. So I know that the goal is to not become infected. However, it's a side benefit that even if you do become infected, that you're not going to be able to say, I spent 60 days in an ICU, intubated, and going to a rehab now because I contracted a very serious form of COVID.
And isn't this a good reason again for wearing the masks and practicing social distancing?
Absolutely.
The
And,
vaccines
you know,
are-
Amy and I can tell you on a firsthand basis, the patients that have come into the hospital who some have made it out and some have not. So it's definitely a great reason to mask up and to get vaccinated. Go ahead, Amy.
Oh, I was going to say the vaccines are 95 to 98% effective in preventing infection, but there are occasional reports of breakthrough infections, even among folks who have been vaccinated. So continuing to wear the mask, especially when you're close to other people or indoors in a public space, is really important to be able to make sure not only that you're preventing it for yourself, because again, for folks who are vaccinated, even if you do get sick, you're very, very extremely unlikely to be hospitalized, but you could still transmit it to somebody else in the community. Particularly our folks who have immune compromise, who can't be vaccinated at this point, as well as our children, the children under 12 who can't be vaccinated yet either. And so it's still a good idea to wear it anytime. Our kind of rule of thumb around here is that we try to strive for 2 of 3, where if you're going to be outdoors, masked, and socially distanced from each other. And if we can generally try to stick with at least 2 of those, we have a pretty solid infection prevention strategy.
Right.
So the
I
next,
agree with Amy.
the next 2 is a kind of together. It says, is outdoors safe without a mask? If outdoors is safe without a mask, when we don't know everyone's vaccination status? And then the follow-up question is, would it be allowed to ask for proof of vaccination before worshiping indoors? Amy, I'm going to let you're the ethicist.
Okay. So here I just want to take a second to talk about some of the values that we have as a congregation and why we're asking even people who are fully vaccinated to be masked when they're indoors. And it really goes to the root of who we are as a community to say, as Portia mentioned earlier, our responsibility is to protect not just the people who are fully vaccinated, but the most vulnerable among us, particularly those who cannot be vaccinated because of medical reasons, immune compromise, and who would be particularly sick if they did contract COVID. And so the way we're approaching this is wearing a mask is generally, nobody's really thrilled about it, but it's a really minor inconvenience. And we're all sort of committed to saying, all right, we'll take on some of those minor inconveniences in a case where it may save somebody's life, particularly a vulnerable member of our community. And so we want to make sure that we're keeping up all of our appropriate protections. We're not going to ask for people's vaccination status, at least at this point. We do know from our congregation that most people have been vaccinated, but again, not everybody can be yet. And so we want to make sure that we're not sort of segregating within our congregation about sort of giving extra privileges to people who can be vaccinated, who have done so already, knowing that we have folks who still can't. And so we're not sort of separating out people because of that, but rather taking the precautions that we would take to protect everybody.
Is it a HIPAA ideal or issue?
It's not a HIPAA issue. HIPAA only applies to covered entities like healthcare providers. So as a congregation, we are not a healthcare provider. So that's not the kind of question. I mean, obviously we do respect folks' health privacy, but it's not a question of violating a federal privacy law because we're not providing healthcare in the congregation.
Are you allowed to ask people if they're vaccinated for some reason?
We are.
There are people who are doing that.
Yeah.
There are different businesses and entities that are asking. So it's not that it can't be done. It's just, up to your discretion. And like Amy said, if you want to be mindful of people's choices, and I think it might be something that you would have to think long and hard about, like to say, what does that mean if you're asking for that information? Does that mean that this group will be able to do this and then another won't be able to do that? I think it's sort of a slippery slope right now, I would say.
Okay. Should we feel safe following CDC guidelines for vaccinated people?
That is a great question. And I think it goes back to what we just said. I am a vaccinated person, but I wear my mask. I'm protecting others. It does not mean that because I'm vaccinated that I'm 100% not going to, get the virus. I mean, I had the virus myself last March and was vaccinated. but still I continue to wear my mask.
That's an
It's
interesting,
the right thing.
if you've had COVID, should you be vaccinated?
As long as it's over 90 days since you recovered, you can be vaccinated.
Okay.
I wear a mask because I'm still I do one-on-one patient contact and I go into different homes and stuff like that. So even though I'm vaccinated, I think it's best for me to wear a mask wherever I go.
I'm assuming that you really don't know when you go into a home, you or Amy, whether or not the folks are necessarily vaccinated. Is that fairly accurate?
Yes, and I also deal with a lot of the psychiatric population that we have that have their own ideas about the virus. And a lot of them are non-compliant with their medication. So that's another group of people that we have to always be concerned about in terms of, are they vaccinated? Will they get vaccinated? You know, depending on where they are in their mental health journey.
And if people are, do we have any cases? One of the questions was, has any fully vaccinated person transmitted the virus to another person? Is that, Amy, you work in out in the public, is that a possibility?
It is a possibility, albeit somewhat remote. And it depends a lot with viruses like this. It depends a lot on the quantity and closeness of the contact. So you may, even if you're vaccinated, you may still have bits of virus in your nose. If you're breathing heavily on somebody or have something aerosolizing, there is some likelihood of that. Again, it's relatively remote, but it is possible. For me, at least, I wear a mask anytime I'm indoors in public, and obviously when I'm at work in the hospital as well. Even though I am vaccinated and got vaccinated the first day that I possibly could, my whole family is vaccinated, except for my child, who still can't be because he's too young to be able to be vaccinated yet. So part of it is, for me, it's a question of solidarity with my child who still needs to wear a mask everywhere, but also just to set a good example in our community to make sure that everybody's protected. And I'd love to hear Army's opinion on it too.
Me? You're on mute. Go ahead.
Oh, sorry. So this is regarding the, I'm sorry, remind me the question again.
Well, we were talking about have fully vaccinated people transmitted the virus to somebody else?
Yes, I think it's possible, just a very, very small chance. But of course, we don't know. We're still learning a lot about the virus itself, and the virus is always mutating, changing. So for me, I work in a doctor's office, so we always have our masks on, regardless of, I'm also vaccinated, and I still wear my mask even when I go outside. So.
Okay. To follow that up with, last night on the news, I heard about the Delta variant from India, and it's supposed to be the most contagious variant. I don't know anything about it. Would somebody like to tell me what that's all about, or what about the variants? And
I can say that there are several other variants, and of course, just as Army mentioned, mutations happen. That's just how viruses stay alive. They replicate and change. And this is about the degree of contagion. But thankfully, we still believe, or the CDC and other authorities are saying that vaccination is still successful against the Delta variant, which is why, again, so very important to consider vaccination, because you can be protected against something that is, even more viral.
Do any of you want to talk specifically about any portion of what you're doing, or about your experiences with the virus or with treatment?
I mean, I can speak to having had COVID, and it is absolutely the scariest thing that has ever happened to me. And I would not wish that upon any person. Yeah, I mean, when you contract COVID, you absolutely don't have any idea which way it's going to go for you. There are some people who come out of it and do well, And there are other people who wind up in ICU, could do well after that, or actually pass away. And so having all of that knowledge for me, and it was the very beginning of COVID, I contracted it in March of last year. It was the most awful thing that I've ever experienced, not because of the physical symptoms so much, even though that was also unpleasant. I've never been short of breath one day in my life, and I was short of breath. But to actually know that the potential of me having to go to a hospital, be intubated, not be with my family because no one was allowed in at that time. And even now, I mean, if you go to a COVID unit, there's still limited restrictions, visitation, and some restrictions on things like that. So, it's an awful thing to have to experience. These patients have essentially been placed in a hospital room by themselves at the scariest time of their life. No one should want that for themselves or their family members. And it also is so distressing to the family member who wants to be there for their loved one and can't be. Amy, I know that you've had many, interactions with families, so you could also speak to that. It is an extremely serious dilemma to have to get to that point and really not have an option, not have a choice.
I've worked with a lot of
Terrible.
patients and families in our COVID units, and particularly our ICUs over the past 15 months. And for me, in some cases, some of the most heartbreaking things were when we had whole families hospitalized together. Because unfortunately they lived in close quarters, and somebody came down with the infection, and then everybody got sick. And it was so difficult because they couldn't be there physically to support each other, either because of visitation restrictions or because other members of their family were hospitalized. It was absolutely gut-wrenching for the people who their other family members or loved ones who may have had to make decisions for multiple people at the same time without being able to actually see them. I have seen folks cut down in the prime of their lives from COVID who were completely healthy prior to contracting the virus, and now either continue to live with symptoms or have died. And it's horrifying for their families especially, but also for our whole community when we have people who again, in some cases may have been sick previously, in many cases not. But to be in those circumstances in which something that we now, at least, and it was certainly different a year ago, but now have some very effective tools to prevent. To me, it's absolutely critically important to continue to use everything at our disposal so that no one else has to die from this.
And I have to say, it's pretty amazing that we've come this far in such a relatively short amount of time to be able to have this vaccine. We did not think that this was possible, and we're here.
Yeah.
So,
and it's highly, highly effective too. I mean, I was looking at the specific statistics now, and over 2 billion vaccines around the world have now been delivered. Obviously, it's not quite 2 billion people because some of them are 2-shot vaccines and some of them are 1-shot vaccines. But over 300 million doses have been given just in the United States alone. Not a single person has died from a vaccine, where we have 600,000 people who have died of COVID. And those are just the people who have died, not even the folks who will continue to live with the symptoms, possibly permanently.
Yeah.
And it's so effective in preventing both the illness itself, but certainly serious illness and death, that to me, it's so critically important that we share this with our communities, that we encourage people to be vaccinated.
Well, on a kind of a non-medical side, when my husband was dying, somebody was with him 24/7, one of the children or myself. And I've thought many times during this COVID period, I cannot imagine having lost him and not been able to be there for him. And yet I've done 3 funerals of husbands and wives dying at almost the same time from the virus. And the pain on their children and grandchildren, losing both of them at the same time, so out of the blue, as you say, with nothing warning them that anything was coming. One of the questions was asking if I might do a pastoral care, hold some sort of a group And John and I have talked about it a little bit. And that's certainly a possibility if there's interest in just getting together and talking about the losses that people have suffered this year. And the losses are not just death. I mean, there's a lot of secondary losses as well. Question, some people have been instructed not to get vaccinated due to their current health issues. Can you give an example, please? I can. I have a friend who received a vaccine about 40 years ago and developed a paralysis called Guillain-Barré. She almost died. As a matter of fact, it was John, her husband, called us and said, the doctor said, you know, prepare yourself, but she did pull through. Her one doctor said to get the vaccine. Her other doctor said not to. Needless to say, she's not getting it. Any other examples? Does anybody know?
I actually was going, just as a counterpoint, I have not heard of any conditions that you, only because I just want to be clear to everyone here that the vaccine isn't like other vaccines. So it's not like a deadened form of the virus. It is a messenger RNA vaccine, which means it is a message that's basically given to the cell to create antibodies. So Guillain-Barré, definitely horrible illness. I can't imagine that sort of vaccine would create a response like that, nor have I even seen any data telling us that we've had patients that have experienced that. It is something that does happen when you have a recombinant vaccine, but not for an RNA, messenger RNA vaccine. So I think that the one doctor that told her to get it was probably correct.
Okay.
I mean, it's still her choice, obviously, but
Yeah, I think she's scared more than anything.
yeah, I mean, that I completely get it, because I mean, she's, you know, you're basically paralyzed.
Yeah.
Guillain-Barré, and
The
you can
only
lose your
folks
airway and all that. So.
Have been actively advised to consider or either getting their vaccines early or not getting them are folks who are in active cancer treatment, like undergoing bone marrow transplants that are specifically sort of destroying the immune system. But even in those cases, they've been either advised to get it beforehand or immediately after they're through their treatment. But those are about the only folks I know of who are sort of medically contraindicated specifically.
Okay, that's good to know.
There may be others. I don't know. Angela or Armee, are you aware of others?
I have a friend who has Lyme disease, and her doctors have recommended her not to get it because her immune system is very compromised. So, and she's been battling it for a number of years, and she's, I think, afraid mostly.
Do you think doctors like that are being overly cautious, or?
I would tend to say yes, only because I think that that's exactly the reason why they should get the vaccine. You know, these are patients who have compromised immune systems. And while I know that the vaccine, when you get it, some people get a little sick, you know, the alternative for getting the actual disease is so much worse, especially for someone who has a compromised system like that. They are the patients that were targeted in the beginning to say, go, please get this vaccine. Because the likelihood of them surviving COVID is very, very small if you don't have an immune system. So
where people are afraid because they've got something else going on, those are really the people that should be getting the vaccination.
yeah, I mean, obviously careful discussion with your physician, but I think the best way to handle it is that every person should be able to do some research of their own to make sure that it's right for them. But I believe that most conditions, especially those that are immune conditions like that, I would say that above all else, you should be getting vaccinated because you don't want to
I think
get to the point where you're exposed.
You say do your some investigating on your own.
Mm-hmm.
I think, unfortunately, sometimes people get wrong information. I'm not sure where they get it from. I had a friend of mine tell me that her daughter was not getting the shot because it could compromise her fertility.
Mm-hmm.
I immediately got my shot on that basis.
Right.
For unfertile, I said go for it.
Yeah.
But people hear that And, you
So
know,
it's important, the source.
yeah,
The
yeah.
source is so
They
important,
hear
you
it
know?
And it gets passed along,
Mhm.
and pretty soon nobody knows what the source is. They just know that they've heard on good authority that whatever.
Yeah.
And I find it's very hard to talk them out of it.
Yeah, I
You know,
mean, I agree. People still try to turn me. And I'm like, really? I just fought for how many months and you really want to send me this information? And yeah, people send articles all the time that I debunk immediately once I read them, but they're nonsense. They're not scientifically based at all. Just like the patients who, 10 patients in Norway died. And it's like, there's no link, there's no causal link to the vaccine, but yet because they took a vaccine, then they must have died because of it. And it is hard to bring someone back from seeing headlines like that. And that's the problem, is that these news, outlets are creating this hysteria, and it's awful because it's untrue. It really is. They just get information and they just slap it out there to the public, and the public eats it up.
Yeah.
And it's important to share from trusted sources too. I mean, obviously talking with your own physician, but also reaching out to folks within our community who are knowledgeable, who do work in these areas. We want to make sure that as a congregation, we're sharing those resources too, that they're evidence-based and appropriate. So as Portia was mentioning earlier, these mRNA vaccines are actually really amazing, because there's absolutely no way to contract any virus from it. They're basically just blueprints to create proteins that help your immune system fight the virus when it does come into contact with it. And that's actually what causes the side effects, is sort of your body ramping up its immune system to fight a virus that it's not actually fighting. But it's really important for folks to know, sort of like, okay, well, why am I having these side effects? Does that mean that I'm sick? To combat misinformation is really difficult. But we also want to reassure people with appropriate evidence and resources.
Okay. I can imagine a scenario where a gathering inside the church is small and known to each other. For example, a small wedding or memorial service. Is it still advisable to maintain a mask mandate in these cases indoors?
I mean, if you're speaking to having just a pod of people that are always known to each other, you can take your mask off. But I mean, in a church where there's people who do not normally live together, I think you should still keep your mask on. It's only if you're in a pod of people that you
or funeral service.
If you're able to socially distance enough, like you're in a big room and you're far apart, I guess if there's like 6 people in the room, that's really a joke. I don't mean that, but if it has to be a very large room for you to be able to take your mask off, I would say, if you're not in a space where you're with those that you've been with, like in a living situation where, people have pods. So if it's not your pod, then, you're still vulnerable to someone who may have the disease.
And also for those who like, again, for folks who are children, say for instance, who still can't be vaccinated and also could still transmit the virus. I think it's really important when we're indoors to continue to wear our masks, especially as a congregation living in solidarity with each other.
When can we start singing in church? Any ideas?
Well, I mean, if you're masked, then you could probably sing.
Hey, Jules, hear that?
I would say that.
Yeah, that wasn't even my question. Somebody else asked that.
And I love that question because, I love to sing. So,
Well, and as a community, we love to sing. I think we may be moving toward there. Hopefully, as people continue to be vaccinated, as our infection rates continue to fall, we might get to a point where it may be safe enough. I don't think we're quite there yet.
Wait, you're not singing now?
Well, so what we're doing now is the congregation is not singing, but we have, and this is all outdoors right now, but we're talking about going indoors. So we have a quartet that sings. And so, and they're 6 feet spaced apart. And there's more than 12 feet from the front of the singer to the beginning of the congregation. There's quite a lot more than 12 feet. So for that, they're all, the singers, the quartet is all vaccinated. So they do not wear their masks outdoors to sing spaced out like that. When we go inside, we'll have to revisit that.
So outdoors right now, the congregation cannot sing.
That's right. They're allowed to hum, but they're not allowed to
Okay.
That was the guideline initially, and I'm wondering whether that's going to change anytime soon.
Are they masked outside or they're not masked outside?
We just let go of their having to be masked once they're in their circle. So
Mm.
coming and going, they wear their mask. And then once they get
Okay.
into their circle, then they can unmask.
Oh,
We have a big front lawn and all the circles, like the circle is for a family unit or whoever it is that lives together. And they're
Mhm.
each of the circles is spaced 6 feet apart.
okay.
So once people are physically distanced from everybody else, then they can sit and take off their masks.
Okay.
The ushers and anybody walking around, the ushers wear their masks
Okay.
because we're interacting with everybody.
Have you seen any guidance about singing? Because there was so much of it. And I have this organization and then my quote day job, that's also a singing organization. And for the longest time, when COVID first appeared, there was a lot about singing because, of course, that was one of the first super spreaders identified was, the choir. And it's gone silent now for quite some time as to the research and as to what's allowable and what's not. The CDC supposedly says that if you look at their table with the pictures of the masked and the non-masked and all like that, they say that singing indoors is okay now. And I'm just looking at that going, I don't get that. I'm not getting that. And I don't know if that's pandering to all the churches who really were insisting on it, or if I don't know what that is, but I just wondered if you all have seen any science or research that's recent rather than, 6 months ago or more.
I guess I was thinking singing with a mask was okay. Without a mask, I'm not sure if that would be okay at the current vaccination levels that we have now. But with a mask, I was under the impression that was okay with a mask. So, but being more cautious is never a bad thing.
Yeah.
That's never a bad thing.
I actually haven't seen anything super recently about that, Julie, but I will look it up.
That'd be great if you could.
Mhm.
For both my organizations, I'd appreciate it.
Yeah, no, I'll check it out. I don't know. I haven't seen the latest guidelines. I am part of a Facebook group of people who are leaders in various religious, spiritual, and other communities in the area who always ask these kinds of questions. And so people routinely share
Mhm.
updated guidance and research and stuff. So I'll check there too.
Thanks.
Sounds good.
Does anybody else have any other questions, or does anybody on the panel have anything that they would like to add at this point? Little bits of wisdom that they've tucked away?
I would even say, like, if you're having a concern about getting the vaccine, obviously talk to your PCP, but even you may even be referred to a specialist like an immunologist or an allergist, just a little something just to give it a little bit more evidence.
Mhm.
I am a little curious if you could, I know that you, several of you, Portia and Angela and Amy particularly talked about, but Tim's question about according to a New York Times article a couple of weeks ago, it did say, and it of course is in favor of people following the guidelines. So it wasn't like some crazy fly by night thing, but it was saying that there are some people who, for medical reasons, cannot get vaccinated or should not get vaccinated right now. And I think, Amy, it was partially, they were talking about cancer patients who
Mhm.
are undergoing treatment, right? But I think they were talking about other people too, maybe that were taking some kind of drugs that the vaccine would interact badly with it. Either it would make the drug, the illness drug, ineffective, or maybe the illness drug would make the vaccine ineffective or something. I don't quite remember exactly what they were, but my question is, if that's the case, if there are people like that we should be concerned about that cannot have the vaccine, how long, and this is a judgment question, I understand, but we want to be mindful of the least and the most vulnerable, the least among us and the most vulnerable among us. And yet that situation may go on forever if this is a chronic condition for that person or something. So is there any way to have any sense of guidance as to how to know how to maneuver these waters when we go inside, which we're hoping to do sometime soon?
Okay, so that's a multifaceted question. I'll try
Yes.
to answer it accordingly.
Yes.
So yeah, it's relatively rare. I haven't seen anything personally about drug interactions. That doesn't mean it's not out there, but I haven't seen anything about medications that might interact with a vaccine. Like I said, it's actually pretty rare. The only real one that I've seen is folks undergoing bone marrow transplants.
Mhm.
Like even folks who are on chemotherapy regimens have actually been encouraged to get vaccinated immediately because their immune systems are compromised.
Mhm.
So it's really fairly rare that I'm aware of that folks are being recommended to not be vaccinated for medical reasons. That said, there are certainly going to be people for whom they do have that kind of complication, or they have other sorts of things that make either a vaccine less effective for them, which may be the case for folks with certain kinds of immune compromise, but also folks who just who may feel more comfortable wearing a mask long term, who may have seen folks who have dealt with long-term side effects of COVID or various other sorts of things. And I think sort of continuing to normalize mask wearing is perfectly fine. We want to certainly welcome folks into our congregation and make them feel as much a part of it, even as we do move indoors. I think continuing to mask until we have a solid level of herd immunity and extremely low infection rates is really important. But also making sure that folks feel welcome to continue to wear them long term is really important too, because we want to make sure that we are protecting everybody in our congregation as much as we can. And again, especially while we have folks like kids under 12 who still can't be vaccinated and can still spread COVID, I think it's incredibly important.
And what about hugging? We're a very huggy church.
I know it's hard because yeah, it's a huggy place.
Yeah, huggy place.
I think we definitely need to wear masks while we're hugging. Would be my own feeling about it based on what I have seen. So I haven't seen any CDC guidance about hugging in a congregation yet, but
People are asking if you,
that's kind of close contact. We're breathing on each other.
and then they hug.
Huh?
People have been asking, if you've been vaccinated, and if you say yes, and they say, well, I've been vaccinated too, and then they hug.
That's right.
Jan and I,
Jan.
Yep.
we miss it.
Mm.
I know that human contact is important.
Well, it's interesting, and I've said this to John, usually part of the service is passing of the peace, and part of that is to say, that we were meant to be in community. And I've seen that time and time again this past year and a half, how true that is. People will talk a little bit about, their jobs and the being at home with the kids and one thing or the, but ultimately it comes down to them saying, what I miss the most is the people.
Yeah.
I mean, we've had some great services. Music has been phenomenal. Sermons are still good, but people miss that contact. We are family in many ways, and we miss being together.
Yeah.
I mean, Angela and I have a very special, she's very special to me, and that I can't hug her and share this feeling. It feels empty.
Yeah.
And I've heard that time and time again as I make phone calls. People miss that.
And that's part of the loss. Like, it's not just, death, as you were saying before, there's so many other losses.
A lot of losses that, have gone on this year.
Yeah.
So.
Just want to quickly say to the panel, thank you for just being such heroes over this last year. And the question that I have is, anybody please answer, is how did you find the resilience to keep going every day? keep showing up day after day. How did you find those kind of inner resources?
It was not easy. But I mean, honestly, for me, I was not frontline any longer, but of course we did get redeployed, and there were some, periods of time where I did go back to the front line, or, was in the command center or something like that. But those nurses, doctors, techs, clerks who did make it in every single day that they needed to come in was the reason why I went back, because they are heroes. I know that we all collectively as nurses, doctors, everything are heroes, but for certain, those people who were right there in the thick of it. And I have to tell you, I mean, I was, but I had the choice to be able to leave and pull myself out and go back to my office, right? But those that couldn't do that, and I was there in the ER and seeing those patients come in, like in the beginning, it was actually like a movie. I can't even begin to describe. There are going to be some awful repercussions emotionally for many of the team members that had to encounter patients like that. It was very, very distressing. However, knowing that we needed to have someone there, and this is what we trained for all our lives, right? You have to be there. We trained. No one ever thought this would happen, really, but this is what we trained for, and this is why we are who we are as nurses and doctors and all the other healthcare team members. There were some people who couldn't do it, and then they retired or stopped working, but the majority of people stayed. And so we did have many different options as far as someone to talk to. I mean, there were many different initiatives that were started. I can just speak for Hackensack Meridian Health that spoke directly to the mental health of the providers who are on the units and taking care of patients. I mean, like when I say direct, I mean written on a grease board right there in the unit. Call this number if you have this issue. My team, patient safety and quality, we rounded on every single one of the teams. If there was any sign of distress, we reached out to people who would come in and work with teams. There was a lot of support to maintain resiliency. It was not easy, but it was done, and we're still, trying to recover. But yeah, I mean, I have to say, it went. If your year went very slowly, our year went, to me, it felt like it went like a lightning bolt. It was just, I don't even understand how we got through it, but we did.
It was a month there where I thought it was going very slow. That was when March hit. I was like, oh my God, I haven't had enough.
March of this year, or you mean March of last year?
March of last year.
Oh yeah, well, in the beginning, I don't know, for me, it just ramped up. Well, for you're a first responder out in the field. I know you guys had to have so much fear, and there were so many things that were changed as far as protocols and laws. I mean, you had to pull to get everyone, the state, the country had to pull together and rewrite a lot of the different rules that were out there. And it was from one moment to the next. I would come in 8 hours later and we would change the entire protocol of everything. It was, you would come in 6 to 8 hours later and there was, 3 more COVID units where they were it was absolutely the most amazing, weird thing that I've ever seen in my life. And I do not think that we will ever see something like this, hopefully, but it was unbelievable. It's very hard to even describe to you, it was unbelievable what we encountered the last year and a half.
I think it's interesting, John and I, Phyllis, we say that we are called to ministry. We use that term, that we receive a call. I think that nurses, first responders, all the people that work in the hospital, truly, that is a call as well. And it's a call that stays with you. My daughter was in the house when the news came on that they were asking retired nurses to come in. My daughter turned to me, she looked at me and she said, don't even think about it. You're 79 years old. But there was a part of me that thought I should be there.
Yep.
It's who we are. You're right.
It is.
It's
You're
weird.
right. Yeah.
You know, we're bone tired. And we still get up and we go because we know that there are people who have been working that 12 or 13, 14-hour shift the night before that need us to come in, and so they can go home and rejuvenate to come back again. And it's a team.
It is. And the patients. Who's going to take care of those patients if we're
Who's
not
gonna
there?
take care of those patients?
Right, right.
You know,
So,
because
I mean,
go ahead.
go ahead. No, go ahead, Angela, you were saying.
I said, if you notice when you're in the hospital, a patient, anybody that passes that corridor or their door, they call out for you. There's no distinction.
Right.
So you could be the janitor or the nurse or the doctor. All they know is, I need help.
Mhm.
And the person that has that uniform and that badge on is a link to being their helper.
Right.
Well, you
Absolutely.
should all be very proud of yourselves because you have done an amazing job. And I thank you so much for being here tonight as well.
Can I say one more thing, that the community also was an amazing source of support. There were so many, I mean, I think the food that we got was just, Amy, you can attest to that. It was
Showing up every day to in my office.
it was like bounds of food, you know. I was still bringing my, you know, I'm on this very strict thing. Like I continued to work out and eat right. So I had to like stay away from that stockpile of
Stockpile of
goodies, but goodness, they really really supported teams.
Yeah.
And that was also
honestly,
great.
that's, you asked about the things that kept us going over the past 15 months. And honestly, for me, it was in large part my colleagues. So just being able to come in knowing that they needed somebody to be able to talk to offer them that support to when they were the bone tired, like go meet with the family. And can you just be the one to tell them stuff today? But also, and at least at Hackensack, I mean, we turned our cafeteria into a 75-bed unit in a few days. Because we had I think at one point we had 15 COVID units. And it was just overwhelming, but also and utterly surreal to walk under these units that are simultaneously incredibly active and incredibly quiet, because there aren't sort of the usual bustle of people and visitors and everything coming in and out. And on the other hand, something happens and it's like, and suddenly it's loud and it's a somewhat disorienting compared to sort of usual clinical care. But also knowing that the people in our community supported us, that I was able to be there for the folks who were caring for the patients every day. And really just to say, look, these are the folks who are caring for our community at its most stressful, most difficult time. To me, that's still, as hard as it is, still a privilege.
Well, and I think one of the greatest ways to say thank you to all of you is to get yourselves vaccinated if you're not. So
I hope everyone here does. And I hope that we provided some of that information that could help you make that decision for sure.
So just things are changing every day as as we receive news and updates from our synod, the CDC, and John has had interdialogue with other ministers through the clergy associations, what other churches are doing. At FCC, we are bound by the idea that there are 3 ways to be safe: wearing a mask, distancing, and vaccination. And you should always observe at least 2 of those. And at FCC, we're going with masks and distancing. Our goals include looking out for the most vulnerable in our congregation and our community as well. That those too young to receive the vaccine and those who cannot for whatever reason. In addition, if we think about it, this is a very Christian way of looking at what we're doing, and that is to care for those The Bible talks about widows and orphans, but those were the most vulnerable back in biblical times. So what we're doing is really very biblical and very Christian. I should say Judeo-Christian. It's not just Christian. In addition, the worship team is meeting constantly to be up to date and to make changes as they come and as we feel it's safe. So we're trying to be very transparent, and as you see, John sends out a multitude of emails. Please watch for them, tell other people to watch for them. We're trying to keep you as informed as we can. Sometimes things change on a day-to-day basis. What worked on Monday by Thursday is completely different again. And if you have questions or you know somebody who has questions, please feel free to contact me through the church office. And John and I are both available for counseling and just if people want to talk. So please get that word out as well. And if there is, if people feel they would like to get some sort of support group going, let me know and I'll, John and I will discuss it. But my thanks to all of you on the panel, to Angela. Angela, it was good seeing you. I haven't seen you in a while. Portia, I hope you do join us and come to worship with us. We would love to have you.
Yeah, I think I'm going to have to do that.
Good. And Amy, of course, good to have you with us. Armee, thank you. And thank you all for coming and asking your questions. John?
Yes. Sorry, I hope this is going to be able to serve others who weren't with us tonight too. So I'm hoping that you get some traffic.
And we're hoping we'll put it up on our FCC webpage so that perhaps people who couldn't see it or might see Liz and say, "Oh, gee, I was going to watch it," and she can say, "Go to the webpage, go to our Facebook page."
And if we could just unmute for a second and give our panelists a huge round of applause, both for the wonderful job they did tonight and for just unbelievable job over the last 15 months. Just so grateful for you. We just give them a huge round of applause.
Thank you.
Thanks, everyone.
Thank you for being here tonight.
Thank
Thank
you.
you all.
All right.
Thank you.
Have a good rest of your evening. Bye-bye.
Right.
Take care.
Bye, everyone.